I went in for a regular mammogram, just a yearly thing, and I had a DCIS in my right breast, diagnosed the day after Christmas. Some mutual friends said, oh, we have a doctor who's, supposed to be the best in his field. And I was like, yeah, I'll just give him a call. And this gentleman, this Dr. Snyder, took so much time with me, spent the day after Christmas on the phone with me, walking me through all the different options and what my diagnosis really meant, and not to freak out, and this was really doable, and I felt so confident after I spoke to him. Dr. Snyder really won me over with the fact that he was so willing to give his personal family time to me when I was in a state of crisis. But I will say, when I started researching all the local doctors and really seeing what my options were, that's when I realized what a rock star Dr. Snyder is. Just from every angle, people praising him.
So Kate had a breast cancer and elected to have bilateral mastectomies. She had reconstruction then with bilateral DIEP flaps, or DIEP flaps, which are flaps where we use tissue from your abdomen, skin and fat from the abdomen. We take a portion of the blood supply out of the muscle that sits below that skin and fat. We disconnect it from the abdomen and then reconnect those blood vessels in the chest. So we're making a breast out of what a breast is skin and fat, and it's 100% her own tissue.
What happens, it's actually pretty intense, and it's super science. It's a 17-hour surgery. The first surgery is done by your surgeon, not the plastic surgeon, so that would not be Dr. Snyder. And that's just the mastectomy, the removal of the breast. And then the second surgery, and the mastectomy is the 2-hour surgery. The rest of the 15 hours is him using my own fat tissue to reconstruct the breasts, reconstruct all the blood vessels. It's pretty intense stuff.
When we use your own tissue, it's something that's going to age with you like normal tissue, like normal breast, and won't require maintenance per se over the course of your lifetime. Once you're reconstructed, it's yours, and it's yours to keep.
It feels great to 4 or 5 months later say, I'm done. I feel great, I'm active, I'm back with my family. It's exactly where I want to be.